guys, welcome back to my channel. I know it's been a while, but I'm back, and I'm back solely doing mental health content. And to start us off, I have Dr. Vundi here with me. I'm going to let her introduce herself shortly, but I just want you to know that you should expect good things, expect living here, having learned something new, expect even to feel inspired, hopefully. So, Dr. Vundi,
thank you so much for having me.
Thank you.
I'm so happy to be on this platform, and I've really been a silent fan. So when you told me that you wanted us to do this, I was so happy. I was like, yes, when? Say less, you know?
Yeah.
And yeah, so if you guys don't know me, I'm a medical doctor. I specialize in psychiatry, and I'm also a content creator. I have a channel where I talk about mental health and wellness. So yeah, thanks for having me.
Thank you for being here, and I'll plug her channel just so you guys can go and check it out as well in case you're interested in more mental health, wellness content. So I asked you guys, we both asked you guys on Instagram. If you don't follow us on Instagram, by the way, I'll leave both of our handles somewhere down here, and we asked you guys to ask us questions about mental health, wellness, anything that you're curious about, any situation you're going through, any dilemma you're in. And we're going to basically answer your questions, both from a personal perspective and from what's the word? Professional perspective as well. So question number one, I have my handy notebook here, is how to deal with anxiety. And I was just telling you earlier, I feel like a lot of people are struggling with anxiety, and I don't know why it's suddenly become so prominent in like our society now. So what would you tell someone who's dealing with anxiety of any sort of form?
The first thing I'd like to say is to first of all seek help from a professional, because there's levels to anxiety, as you know. There is now anxiety disorder, which is an illness that requires medication, right? So come to us so that we check, is this anxiety the one that's normal, or has it crossed over to be clinical? So that's for guys who are having clinical anxiety. But if it's the one for work related or even COVID related, I think that's maybe one reason.
I think so, yeah. I think just because of being in such a strange world that we've never really lived in, and experiencing new things in a pandemic, that must be a big cause of anxiety.
Exactly. So those guys, I think those are the guys we're trying to address, right? So the first thing I'd like to say is anxiety, the best therapy for anxiety is order. Because if you're cluttering, you're cluttered in your life, you're disorganized, it's going to worsen or heighten your anxiety. So start by just decluttering your life. And the best way to do that is to start with a morning and evening routine.
Okay.
In the morning, si kuamka tu, then you know, you're like showering, going, wake up and be like, okay, how do I feel today? What am I supposed to be doing? Plan your day out. And then in the evening, do the same thing and switch off. So have a shutdown, you know, no social media 1 hour before you fall asleep. Chill, breathe, relax, and then have a wind down and then sleep. So routines are really good for anxiety.
Okay.
Yeah, that's my first advice.
What if you have panic attacks as a result of the anxiety? Because I know panic attacks are a prominent thing for people with anxiety. So
yes, they are.
What do you do then? Like how do you manage?
That's really true. In fact, the funny thing is I had a patient who used to tell me, like, the moment she steps into her workplace, it's a very high pressure workplace. I can't name the name, but just think a top organization. The minute she steps into the office, she gets a panic attack. Heart is racing, hands are shaking like it's bad. Yeah, so and it only happens when it's job
at work.
And you see, I can't tell her quit your job, you know. So we worked through a lot of things, and one thing that really helped her is breathing exercises. So I taught her this technique. Okay, it's not my technique.
Yeah, it's a technique that's out there.
It's out there. It's called a 7-11. So you inhale for 7 seconds, you hold your breath, and then exhale for 11. So she would do that as she's even walking into the office. And what that does is it controls your heart rate, it slows it down, so you're actually getting ahead of the panic attack. So you can do it anywhere, in traffic, even at your, if like guys don't have to know you're doing the breathing exercises, you can just do it, and that usually de-escalates the situation.
All right. I think my advice would be I feel like every single mental health issue that we struggle with, even if it's anxiety, it's very personal. It's how you handle your anxiety is not how I'll handle my anxiety.
Right.
So find ways, because these things, for me, in my experience, I found that it's kind of like trial and error. So maybe breathing exercises work for you, but they don't work for me. So what works for me? So you just have to figure out maybe a routine or a way to, you know, cope that's specific to you.
I love that.
And then I think that's the best way to deal with it. There's so much information online on different techniques you can apply, and then find the one that works for you. So, second question. Toxic family and parents. This one is, it's a lot, because I know a lot of us struggle with that. And I think one of the things that frustrates me the most is that people really invalidate it and try to make it look like, how can you not be okay with your parents? You know, they're your parents. So how do you deal with it? How do you handle an environment where you're surrounded by toxic family, toxic parents?
It's as you said earlier, even when we were talking about anxiety, it's very situational. So I don't think there's one blanket statement. But I guess it would be first to identify the root cause. So number one, do you have a role to play in the toxicity? Or is it purely them? And the reason I'm saying this is because sometimes it's so easy to put blame on. They did this, my mom is a narcissist, my dad is ABCD. But sometimes we realize you become passive aggressive, you end up becoming toxic as well. So first of all, is there something you can do? I always like to ask myself that question. Me, what can I do? And if truly there's nothing you can do, it's them who are toxic. I believe in something that's called no contact, but done in a very what's the word, like it's not complete no contact. So I don't mean stop talking to your mom or stop talking to your dad, but you can love somebody from a distance. You don't have to completely invite them into your life. They
don't have to be fully present in your life.
But then you're still, I mean, you still give them the respect they deserve. I think that's advice I'd give, and that works even for narcissists.
That's true.
Just maintain that modified no contact.
I like that. I think I would say boundaries. Setting boundaries is really helpful when you're dealing with anyone toxic, be it family, be it friends, be it whoever. As long as they're toxic, just setting boundaries that will protect you and just make sure that your interests are served and that your mental health is okay. But I know setting boundaries with especially parents can be really difficult because they don't understand the concept of boundaries, especially if they're toxic. So I think for me still boundaries would be the biggest thing for me, but it takes time.
It takes time.
A lot of time before they even accept the boundaries. So you have to be really resilient with it.
Recently there was a conversation, it should have been maybe 2 days ago, where a prominent person was talking about how his parents are toxic and you know he cut them off. And it's so funny that people in the comment section were like, you know, you should forgive your parents, it's an African religion, you sprinkle religion on it.
No.
And I just wanted to say, if you're in that situation and if you've been with an abusive parent, let nobody force you to forgive. Forgiveness takes many forms. You know, you can forgive somebody, but it doesn't mean you give them the forum to hurt you again, to abuse you again. So I also think when it comes to toxic people, apply forgiveness in your own way. In your own way. Don't be forced by people to, you must do this, you must do that. No, you don't.
Not in the standards of the world. Like, do what is best for you. And it's going to bring up a lot of resistance naturally, so expect resistance, but then you just have to like remember why you're doing it in the first place and just stay grounded through it all.
And the peace that comes with it, like even if everybody is upset and they're making noise, me, I'm so happy I chose me. And I encourage you, choose you.
choose you. Can we make that a hashtag? Can we
choose you?
Hashtag choose you. Tweet it. Let's tweet it. So, next question, which I really love. How do you comfort someone with depression without invalidating their feelings?
Wow. The thing I can think of is, first of all, to anybody who has somebody who is depressed or has any mental health issue.
Yeah.
Just read, gather information, because sometimes I think we do things out of ignorance.
Yeah.
We say things out of ignorance. Somebody can tell you they're depressed, and then you ask them, now why are you so depressed? You have such a nice life. You're so beautiful, but you have a boyfriend, like you have a job.
Your life is so nice.
Exactly. And you've not Googled what is depression, like it's an actual illness, you know. So do your research and find out what do these people need. That's the first thing I would say.
I think what I would say, especially if someone comes to you telling you they're feeling depressed, is just to be present. Be present and make them, reassure them that you're there for them. Saying, validating statements like, I am here for you, I hear you, if you need anything, call me, if you need anything, text me. And even just, you don't even really have to say anything, but just offer your presence there so they don't feel like they're alone, because I think a lot of people who are depressed feel like they're alone and they're just doing life on their own. I
love what you said about, because sometimes you're focused on what to say, the wording, but I think actions always speak louder. And with people who have depression, they have low energy levels. Sometimes something as simple as waking up and making the bed and showering is so difficult. So perhaps you can just go to their house, just physically go and look around. Literally help them declutter the house, clean the house, cook for them, do even for them shopping, just sit with them. You can be doing nothing, by the way, just sit with them. I like that act of, what's it called, acts of service. I think it works really well for people who are depressed. In 2015, my dad passed away, and that was the worst period of my life because I was also in a bad place. So it found me in a bad place. I was failing in med school. I was drinking all the time. I was just not doing well, and I was in a bad state. And let me tell you, I can't remember the things people said to me. I can only remember the people who showed up for me. And I remember especially my sister. She was at the time working at a restaurant. Like, she would send me food. She would just show up. She'd be physically there with me. Like, even on those nights where I'm drinking myself silly, she would just be there with me. She's not drinking, but she's just there, and I feel like I'm in a safe space. So I really hope that that's what we can do for people, more than actually judging them or making them feel bad, because there are people who make you feel bad for being depressed.
Okay, I agree. So next question is about setting boundaries. How to have healthy boundaries, especially with people who are not in your life anymore. But boundary setting in general. For setting boundaries, I have two rules. Number one is communicate your boundary very clearly, because sometimes our boundaries are crossed because you've not communicated it. And then secondly, implement the consequences of somebody breaking your boundary, because sometimes your boundary is broken and you don't let the person know that there is a consequence. And this is what I mean. If, for example, you're my friend and my boundary is very clear that when I tell you something I really don't want you telling your other friends, and I make it clear, I communicate, then I find out you've done it. What do most of us do? We get pissed, silent treatment. I say Sharon is a bad friend, I cut you off, you know. But why don't I just communicate to you that you cross this boundary and I'm upset, you know? That's, for me, actually, I'm those people for cutting off, and I had to learn that I need to communicate that you've hurt me, and because of that I'm feeling bad, and because of that I might not tell you stuff in the future until I feel safe. Like, I had to learn how to do that. It's difficult because I'm wired to be petty, but I try every day to just like communicate and let you know I'm doing this as a consequence of what you did. Okay. All right. I think for boundary setting, I'm still like learning through it. I'm in like my season. Is it a season? Season of learning how to set boundaries with people. But I think I would say just prioritize your needs when you choose the boundaries you want to set. Especially because a lot of people who struggle to set boundaries are usually people pleasers, which I am a recovering people pleaser. So it's going to be hard for you to prioritize yourself when you're thinking of the boundaries, and you'll think of the other person or the other people involved. So I would say prioritize yourself and then figure out what boundaries exactly you want to set and how they're beneficial to you or the relationship that you're trying to figure out. I think with people who are not in your life anymore, those boundaries have to be a bit stronger than people who you're trying to still have a relationship with.
Let me ask you a question. What if, okay, somebody is not in your life anymore, but they want closure, all right? I always wonder, I mean, if I'm not comfortable with meeting someone from my past, but they want closure, should I just go? Like, do I owe it to that person to give them a forum for closure? Because this is something that's really common.
Okay.
Let's meet for closure. But like, what if I don't want to?
My opinion on closure is, yeah, if it works for you, great. This is my personal opinion. You don't. By the way, yeah, this is my personal opinion. You don't need closure to move on. That's just what I think. If the person has said, yeah, this is, we're done, you're done. You know, I feel like even closure brings up some like past things that even hurts you more. So if someone wants closure and you're not comfortable with giving them closure, just relay that same information to them. Like, yes, I understand where you're coming from, but I'm not in a place where I can give that to you, and I wish you well.
Yeah, and I agree with you, because I feel like you might be taking a few steps back.
Yeah,
by trying to help this person to get their closure, and at the end of the day, we are choosing us, right? So I agree with you. I don't believe in closure at all. And if somebody is committed to misunderstand you, but that closure will never.
It will.
If
nothing is going to change.
It will not change anything.
Yep. All right. So final question is on letting go. Why is it so hard to let go of someone even when you know they're not good for you?
Wow, there are several things. I have actually been in that situation where it was so hard for me to let go of a particular romantic relationship, but it's because I was in a bad place in life.
Okay.
I was just, as I mentioned earlier, I was just not taking care of myself. I had low self-esteem, low self-worth. So I thought that was the best I could do. I didn't think I deserved better. So I think that's one of the reasons people struggle with. And for me, I was like so attached, because even after it ended, I was like, now nobody can love me, you know. So I just keep trying to get back with this person. Yeah. Because I think that's all I can get.
Even though you know they're not good for you.
But the moment I started realizing, actually, as in, you know, I'm worth it, I'm like amazing, I'm this and that, I started even now attracting people who actually were on my level.
Oh, that's so good. But if you're struggling to let go of someone who you clearly know is not good for you, you need to ask yourself, why are you still there and you know they're not good for you? You probably have some self-defeating beliefs. You probably have some self-esteem issues you need to look into. Because if you accept less than what you are, then it means you don't see yourself on the level you actually are on. You know, so you're just allowing someone toxic, someone bad, someone who doesn't treat you well to treat you badly. Why are you allowing that? It means that there are things on the inside you need to look into and figure out that. And once you do that, imagine you let go. You'll realize, just like she said, that you deserve way more than what you're being offered right now. And I think for me, what helped me, which was now in a romantic setting, is that I started going out on dates. And even in those small dates, even if it's just a guy I met once and I never met him again, they were probably more kind to me. They were probably more of a gentleman to me. They were probably, you know, more sweet to me than this relationship that I was in for 2 years of my life. And I was like, you know what? Kumbe I can do better. Kumbe there's better out there. So yeah, I think you need to look into yourself and figure out why you're allowing yourself to receive less than what you are. Yeah.
Exactly. And I think a lot of women, like some patients I see, have helped me realize that a lot of men use emotional abuse to make women feel like they can't do better. Like, I'm doing you a favor, you know, dating you. Some men actually go the extra mile to tell you, nobody can date you. You can never get a guy like me, especially if the guy maybe is rich or he's popular or he's hot or whatever. They can actually use those gaslighting techniques, paka you start doubting your reality and you start thinking, hiya, genuinely, I can't get better than this guy.
This is as good as it gets.
So sometimes please try and identify, is this person emotionally manipulating you into thinking negative thoughts about yourself? Because sometimes that's what's going on, and when you identify that, you can be able to put a stop to it and get out of that situation.
Yeah, I agree. I agree.
Yeah,
that's it. Like, those are all our questions. Thank you so much. This was so much fun. I've also learned a lot in this short time. Do you have anything to say before we end the video?
Yeah, first of all, you must come onto my channel.
I must. I must say less.
But honestly, when you are speaking, you sound like a therapist. Like, I would want to sit on your couch and tell you all my problems, and I'm here for it. I really wish you all the best in this channel. I love this new direction.
Thank you.
And for anybody who's watching, who's feeling like you might have a deep-rooted issue, a bigger issue, please reach out to me. You can DM me on my social media handles. I always try and respond, but just don't say those things for hi and then you keep quiet. Please just say exactly what your issue is, and I can see how I can help you.
All right. Thank you guys so much for watching. I'm just so happy that I'm finally doing this, and I'm so happy that you are my first guest. And I'm looking forward to sharing many more episodes and much more information, much more content in regards to mental health and wellness. If you have any questions, please feel free to leave them in the comment section, and I or Dr. Vundi will respond to you if it's directed to her. And I'll see you guys in my next video. Thank you so much, and please don't forget to subscribe somewhere here or here. I don't know where, but yeah, see you guys in the next episode. Bye.